The new method is based on the application of a laser fiber that is completely different in design. Until now, the laser energy was transmitted in a straight line along the light guide, thereby heating the blood and having a thermal effect through the blood to the vein wall. The laser fiber used today is constructed in a completely different way. The laser energy is dispersed at the fiber tip so that it can have a direct spherical impact on the vein wall. It is dispersed around the tip and not, as was previously the case, emitted into the blood as a concentrated beam at the tip. This technique and this innovation enable the insufficient vein to be occluded using lower energy levels, and the effectiveness of the surgical treatment ought to be even higher than it was using the previous fibers.
With a spherical fiber, there's a concentration of energy in front of the tip, creating a cylindrical energy cloud. This cylindrical energy cloud is spreading homogeneously along the vein wall and additionally heating the blood as well. So we get the double effect and can homogeneously completely fill the vein with energy. The effect here is that, as you have seen in your surgery before, we need about 25% less energy output from the laser. And additionally, the risk of vein wall perforation is being lowered because it is not just the tip of the fiber which heats. And in the end, as a surgeon, you have the choice between two basically perfect emission processes. If you like to work continuous, you can use the Venex 360 degrees, which basically gives you a homogeneous spread over the vein wall while pulling back continuously. Or if you like to work in pulses, basically 1 second on, pulling back, then 1 second on again, then the spherical fiber gives you the better effect. Because the radial fiber has to be used in continuous mode, otherwise you would create hot spots and cold spots on the vein wall, whereas the spherical, you're open to both directions. Basically, if it wouldn't be profitable in economic aspect, we know we wouldn't have a chance in the market, this is clear. We have checked the reimbursement situations in several different countries, and the pricing will be in the range that the system altogether will be profitable with 2 patients a week within 1 year.
The laser serves for closing the main trunks that supply the vein branches from which the varicose veins are most frequently formed. Here we have thus occluded the trunk of the vena saphina magna, which was insufficient from the groin down to 1/3 of the lower leg. And you can see this, can't you? There's a bruise, a hematoma. The hematoma occurred as a result of the earlier needle insertion for the tumescent anesthesia. That is, for numbing the vein, hence the bruise. Here the vein runs subdermally, and there is a slight temporary inflammation after carrying out the laser treatment. The lateral veins that have not yet been occluded are, on the other hand, closed by a supplementary sclerotherapy using the first sitting after the laser treatment in order to accelerate the occlusion. Here we can see the vena femoralis, the deep femoral vein that is completely passable and efficient. We will now show you the vena saphina magna, the large vein that lies less deep. It is blocked and insufficient. It does not produce any signal at all, therefore it's closed. Here we have a small discoloration, but it's really small in a transitional state. It will disappear within a short time.
Wycofuje się w przeciągu bardzo krótkiego okresu czasu.